Hello, in this presentation you will be learning about the surgical weight loss options offered through the Center for Weight Management and Bariatric Surgery at Lowell General Hospital. Let's begin by defining morbid obesity. Morbid obesity is defined as a disease of excess body fat. It is often related to genetics, comorbidities, and it is a lifelong, progressive, life-threatening, and costly disease. It is also defined as a body mass index of 40 or more, which means you are approximately 100 pounds overweight. If you're considering making a change about your weight, know that you're not alone. 66% of adults are overweight or obese in the United States. Poor diet and physical inactivity is the second leading cause of death behind tobacco smoking. As mentioned, obesity is defined as a body mass index, or BMI, of 40 or more. A BMI is calculated based on your weight in relation to your height. So, someone that is 5 feet 6 inches tall and weighs 250 pounds would have a BMI of 40. Basically, a BMI is used as two adults could weigh the same, but one person may be taller. The taller person's weight may be distributed differently, and she or he would not be considered obese, but the shorter person may be. We also said obesity is associated with comorbidities. This means people who are obese are also at risk for other medical conditions. 20 to 40% are at risk for diabetes, 40 to 65% are at risk for high blood pressure and high cholesterol. You are even at a higher risk for cancer, in particular breast, prostate, and colon cancer if you are obese. The good news is most of these medical conditions resolve or improve after weight loss surgery. 95% of diabetes gets better, 97% of high cholesterol improves, and 92% of high blood pressure resolves or improves. So why surgery? You've all been there and tried extreme diets where you eliminate carbohydrates or do a liquid diet for a while and are really good about exercising to lose weight. This may be effective short term, but once you stop the diet or exercise, you regain the weight you lost and sometimes even double. So surgery is recommended as diet and exercise alone are not effective long term in the morbidly obese, and the benefits of surgery outweigh the risks of staying morbidly obese. The National Institute of Health states, permanent weight change is almost impossible for the severely obese by means presently available, with the exception of surgery. This means surgery helps with consistent and permanent weight loss for those that are morbidly obese, which you cannot get from following a diet and exercise program. National Institute of Health also states surgery should be done on patients that have a BMI of 40 or more, or have a BMI of 35 to 39 with 2 or more comorbidities, such as diabetes, high blood pressure, or sleep apnea. They recommend patients have trialed a medically supervised weight loss program and recommend surgery is performed by a multidisciplinary team. So that means you're not going to a program, meeting with a surgeon, having surgery the next day, and then that's it. In order to be successful, you have to make sure you are following nutrition and medical guidelines so that you lose weight and are healthy while doing so. We do have a multidisciplinary team here at Lowell General Hospital. Our team consists of dietitians, mental health providers, surgeons, and mid-level providers who will be available to you for guidance. NIH also recommends you are committed to a lifelong surveillance, so you are compliant with coming in for scheduled appointments and following the advice you are given. So who is a surgical candidate? You must meet the National Institute of Health criteria, mainly the BMI criteria. You must not have any endocrine cause of obesity. For instance, you may have an endocrine issue such as with your thyroid, but it must be controlled with medication and not be the cause of your weight gain. Patients should not have any uncontrolled psychological conditions. So again, you may be diagnosed with depression or anxiety, but it has to be controlled either through medications or counseling. If you've been hospitalized for any psychological conditions, you must wait 18 months prior to qualifying for surgery. You must be absent of drug or alcohol problems for 18 months prior to surgery. You must be 12 months postpartum, which means 1 year since delivering a baby. You must be a non-smoker. We will not treat the number 2 cause of death if you're still doing the number 1 cause of death. The whole team must agree you are a good candidate, and you have to be dedicated to a lifestyle change and follow-up. At Lowell General Hospital, we offer a restrictive surgery called the sleeve gastrectomy and we offer a restrictive and malabsorptive surgery called the Roux-en-Y gastric bypass. Let's review each of the surgeries now. The first surgery we're going to talk about is called the sleeve gastrectomy. In this surgery, we remove 75% of your stomach by cutting along the greater curvature of your stomach. So you're left with a small stomach that is like a sleeve or a tube-like structure. Therefore, you eat small portions since your stomach is smaller, and you feel full faster from eating those small portions. Advantages include that there is no rerouting of intestines, and food is still following the same passage where it goes from your esophagus to your stomach to your intestines. Disadvantages include that there is stapling involved and part of your stomach is removed. Therefore, it is not reversible. We cannot reattach the stomach we removed at a later time. There is a potential to have an increase in heartburn or reflux, as a new stomach is considered a higher pressure system since the valve called the pylorus between the end of the stomach and the small intestines stay in place. The other surgery that is offered here at Lowell General Hospital is a Roux-en-Y gastric bypass. There are two things done with this surgery that will help you lose weight. One, the surgeon creates a small stomach, the size of a golf ball. So like the sleeve, you have a smaller stomach that we call a pouch, which allows you to eat small portions and feel full faster. And two, this new stomach is connected to the second half of your small intestines, so now food enters the new small pouch and then bypasses the remainder of your stomach and part of your small intestines where calories are absorbed. So you're losing weight in two ways. One, you have a smaller stomach, and two, you're absorbing less calories. Advantages of the gastric bypass is it is considered the gold standard procedure or the recommended procedure in the United States. It has been researched the most, so we have a lot of data or information about this surgery available. It is the fastest and greater weight loss because you lose weight in two ways. There's no adjustments required. Dumping syndrome I will come back to after talking about the disadvantages. Disadvantages are that there is stomach stapling and rerouting of your intestines involved. If you have bariatric surgery, you lose weight, you reduce or improve your comorbidities such as high blood pressure and diabetes, you live longer, and you improve your quality of life. Some patients simply appreciate being able to keep up with their children or grandchildren after losing weight, and others just appreciate being able to fit in an airplane seat. All surgeries are performed at Lowell General at our main campus located on Varnum Ave in Lowell. Our center is considered a bariatric center of excellence with the American College of Surgeons and Aetna. All surgeries are done laparoscopic, which means that it's performed with small incisions versus open, which is with one big incision. The advantages of having laparoscopic surgery is that there are fewer wound complications such as infections and lower risks of hernias. It is a faster recovery and patients have less pain. Surgeons have a better view of the anatomy as well, as they're using high-definition cameras and monitors. The take-home point is that this is not cosmetic surgery. No procedure is better than the other. We want patients to choose which surgery they want, and we will provide guidance. Most importantly, remember surgery is only the first part of the process. I also wanted to briefly talk to you about what to expect after surgery. Your first visit in our clinic will be 7 to 10 days after surgery. Then we will be seeing you every 3 months for the first 2 years. We want you to be our patient for life, so we do want you to come in and see us once a year after 2 years, just like you would go see your primary care physician annually for a physical. Research shows that patients that continue to follow up are overall more successful with their weight loss. Women are advised to wait 2 years after bariatric surgery to become pregnant. It is safe to become pregnant before 2 years, but you may not lose all the weight your surgery may have helped you lose if you become pregnant before the 2 years. Also, you may not feel well as you are already restricted in your calories and the baby consumes a certain amount of calories, so you feel very drained. You will also be having blood work done every 3 months to check vitamin levels. Okay, so how do you get a surgery date? You want to check if your insurance covers the surgery, so call the customer service number on the back of your insurance card and ask if weight loss surgery is covered. Next, at the end of this presentation, You will want to fill out your name, phone number, address, insurance information, and email address. A patient advocate from the Center for Weight Management will contact you within 5 business days to schedule an initial appointment. Before your initial appointment, please complete the medical and behavioral questionnaire and bring them to your appointment. The questionnaires can be downloaded online or mailed to you.